Hey, everybody, this is Munson Steve. We're on Health IQ. There are those individual brothers that are boundless who are actually doing and are committed to saving the lives of brothers in particular. One is Dr. Burnett. What is happening with you?
Well,
Here at
I'm
Health
delighted to
IQ.
I'm delighted to join you. It's my pleasure, and I just happen to be a healthcare advocate and supporter of our Black men, by all means.
Well, there are a lot of issues, men, but you got a specialty. Why don't you share your specialty with us for those in the audience so that they can share this video with some of their friends and family members?
Absolutely. So I'm a urologic surgeon here at the Johns Hopkins Medical Institutions in Baltimore, Maryland. Uh, so a urologist and a surgeon. What that means is I have a focus of my medical training background and experience in the area of men's health and in the area of the pelvis. With a major role in urinary tract problems such as prostate diseases, prostate cancer. I've been very involved in this area for the past 30, 35 years here at this institution. I run a research laboratory, but I also do surgeries. I see patients. I'm involved in various kinds of guidelines and various other health policy activities, and very much involved in these sorts of things too, sharing good information.
When you first started your journey, where were you in undergrad when you decided and that you wanted to be a physician? What motivated you?
Right. Well, I had a sense that that it was my calling to be a physician and even a surgeon. Believe it or not, in my adolescent years, I had some exposures to physicians and surgeons just through some various contacts. I grew up in Washington D.C., had some exposure to Howard University in our nation's capital. Was able to do well in school and science, and so I sensed that I had the aptitude to do it, and I really had a sense, frankly, that I wanted to care for others. I wanted to help others, and I felt that that was my calling, and I was really inspired to see that physicians and surgeons could do that.
So when you decided that this practice would head toward urology and that you would be focusing on Black men, how'd that come about?
Well, I think it was uh, an awareness that I could have impact, as I mentioned, in the field of medicine as a surgeon who happens to be Black, and recognize where I could address areas that I think are under addressed. There's no doubt in our current uh, social and political and economic climate of the world that we recognize healthcare disparities out there. And I just felt almost that it's a duty that I even knew 20, 30 years ago, that to become a Black surgeon in urology meant that I could have a role, particularly in the arena surrounding prostate cancers that so disproportionately affects Black men. We know that 1 in every 9 man in general will get prostate cancer in his lifetime. Among Black men, it's 1 in 6. So you can see there is a difference there, a higher rate of having prostate cancer. And believe it or not, the mortality rate, that is dying from prostate cancer, is 2.5 fold among Black men compared to counterparts. So this is all to say that even back then, going through medical school, I realized that one of the areas that I thought I could have impact in was urology. Urology had to do with men's health, prostate diseases, prostate cancer. I even had that kind of revelation back then that I could get into a career that could hopefully bring about some of this. It's a better recognition of these kinds of issues, support of these issues, and maybe even affect some change.
So we're going to take maybe out because you truly a change agent in the area. Um, why research? Why is research important, and why should we, as a community, a Black community, participate in research, medical research?
Yeah, so medical research seems like such a daunting word. When we say that word research, we all kind of think back to our years in high school and college, and it's like, oh man, I don't know if I can even handle research. What's that all about? It sounds like that's for the brainy guys. But research means that if you've got an inquisitive mind and you think that something is a question that needs an answer, and we can carry out some sort of investigation to address a problem that exists, Hey, you just define research there. And as I just mentioned, I threw out a few statistics surrounding prostate cancer. Why is it that black men are more affected? Why is it that black men die of this? We need to get some answers. We need to get some answers, and we need to figure out how we can make sure we save the lives of our black men. So research is fundamental to this. Research means that you're not just going to accept whatever happens and just the world goes on. No, we need to step up and say, we're going to ask some questions. We're going to do some investigative work to try and figure out what we can do to make differences out there and save our black men's lives.
So, young black men, we're sitting there having a barbershop talk. You're just graduating from high school, getting ready to head to college. What should you know that your behavior could be as a young black man as it relates to getting tested for prostate?
Yeah, well, that's an important point there. I mean, at the very least, we need to recognize this disease state affects black men disproportionately, and that we all need to be aware of the high incidence rate out there, such that action can be taken. Even as a young man, recognize your family history. We know that even the rate even goes up higher if you have it can go up to as much as 1 in 4 men. If you have a father, a brother with prostate cancer, know that. We know that in black men, prostate cancer also may affect men at younger ages. We used to say, based on the American Cancer Society recommendations, that men above age 50 should just go and get screened. Well, we made it to change that tune. And I think that since I see so many black men in their 40s even with prostate cancer, I think men need to consider that at age 40 even, they should get a basic evaluation to determine whether or not they possibly have prostate cancer. We're talking about prostate cancer screening. So again, recognition of the problem and then taking some action to get evaluated is what we're talking about.
Well, let's look at evaluation because some men are not comfortable with the idea of an evaluation. And what would you think that an accountability partner, you as a black man, with one of your best friends or your brothers, and you knew that your father had prostate cancer, what should you all be doing together? Uh, should they be testing at age 40? Should they be doing it annually, biannually?
Well, let's get down a little bit more in the weeds about this. And I just want to give you an overview and how important it is. In terms of testing, we're talking about evaluations that typically consist of a blood test called the PSA, prostate specific antigen, and complementing that is what we call the digital rectal examination. Although we're recognizing more and more that the majority of prostate cancer cases will be identified by this blood test. But at the same time, checking the prostate too, which everybody fears. I don't want my prostate checked because that's a finger in the bottom. But there may be occasional findings of many with prostate cancer that the PSA evaluation did not detect. Now, to be specific, the PSA refers to a protein or chemical that's released from prostate cells. No other tissues in the body release this chemical, and it gets into the bloodstream. And we know there should be kind of a certain range of values, as we have range of values for all kinds of blood tests we get. We know what your normal level should be for your glucose level, let's say, or various electrolytes in the body, sodium, potassium, so forth. So for the PSA, we know there's a normal range. Typically, is between 0 and 4. I won't get all the units and make things more confusing. But if it gets outside that range, it gets elevated, okay, then we have to say something is not right with that man's prostate. Something's not right. Now, we know the prostate cancer is related to PSA elevations, but other things can happen to the prostate too that can confound that PSA measurement. Having a larger prostate, having infections of the prostate. These are two of the more notorious things that can throw a man's PSA. And sometimes men just happen to have PSAs that get a little high just in the course of lifetime. But what you're asking is, what should a man do? Well, yes, if you think that you're at risk or you're age 40 or African American, and if you have a family history, you got to get in and get your blood test done. Get your PSA test done at the very least, and possibly the prostate exam. Although again, men are not always keen about that. But I still advocate getting both things done, because there may be a few situations where we don't see a PSA elevation, and something's still going on with prostate cancer, where we feel on a glove finger in a man's bottom feeling his prostate, that there's hardness or something irregular about the prostate that says, hey, this is suspicious. Now, I'll go one step further. I'm gonna let you ask the next question, but where do we go next with this information? Yeah, okay. And where we go next with this information, because much of this screening can be done in a primary care doctor's office, a regular health practitioner's office, even a nurse practitioner can carry out a blood test called the PSA, or even do a prostate check. But if something's abnormal about that, then you probably at that stage need to be referred to a urologist, and a urologist then can go on with further evaluation.
So for the brother who's over 40, an annual PSA should be one of the mandatories for he and his accountability partner of the same age to just begin that constant screening annually.
I would concur. At the very least, start at age 40. Now, we sometimes find that a person's exam is so reassuringly minimal. Let's say, I'll give you an example, a PSA that's less than 1. And those guys, gosh, that the odds of having something happen is low enough that we might say, okay, come back in 3 years or come back in 5 years, we'll check it. But in general, just a rule of thumb, as you're saying, is get your annual checkup starting at age 40. That way we're on top of things. As we know, when black men, we tell them come back at a certain time, they don't always come back anyway. So if I say come back in 3 years, then I'll never see the guy again. So maybe just tell them come back every year. But these are some of the nuances that we talk about. But at least get an initial screening evaluation at age 40. And if something looks a little suspicious, let's suppose your PSA is a 3 value. It's like, that's concerning. Come back next year. Now it's 3.5. Well, something's changing. Even if it's still less than 4, and say, well, maybe even for a black man, get over to your urologist, let us see what's going on with that. And we may want to carry out further evaluations to help us know whether this trend towards the PSA going higher, because something's happening to the prostate, may then prompt us to carry out more evaluations.
So for all those barbers that cut hair, is there a number that we should have on the wall that says 40 PSA and kind of move in a direction, given that Black men have that number that you shared that hits us much harder than others, that we just annually make it a part of our health regimen to really check in on ourselves?
Oh, no doubt. I would strongly support that thinking. That put it on the barbershop wall. You're age 40, get your PSA, know your statistics, as we say. Men know all the sports statistics out there. Why can't they know their own health statistics, right? And so at least, like I say, get screened at age 40, get a PSA, know that the range is between 0 and 4. Maybe that's helpful to know. If it's above that, don't dilly dally. Definitely, that's worrisome. And some will argue that for black men, even above 2.5, we should be concerned. But just put the message out there: get screened for your prostate, know your family history, and age 40 is probably a wise age to start it.
So many men who might have this issue are now going to have to come to a urologist and begin thinking about what type of treatment should they get a diagnosis with prostate cancer. Where are we now in the 1 to 2 to 3 more popular treatments? And if you kind of share some insight on, so that we're not surprised or not afraid more than anything, that there are physicians like yourself, doctor, that are really dedicated urologists to helping us walk through this process so we don't feel alone or that we can't beat it.
Yes, yes. Well, you touched on a couple of things. There are a couple of touch points that I'm going to get to. One is you're saying, how do we get through all of this confusing picture of dealing with prostate cancer? And of course, I'm going to take one step back that I want to make sure we're clear about, because to get to the diagnosis of prostate cancer is not solely just a matter of an elevated PSA. Once you do get referred to a urologist, as I mentioned a moment ago, there are many things that can make the PSA go up in an abnormal way. And just having an elevated PSA does not make the diagnosis alone. We do, as urologists, have to carry on to the next part of the evaluation, which is a prostate biopsy. And that is to do a sampling of the prostate. We often now are also combining this with imaging studies of the prostate called MRI, magnetic resonance imaging. So MRI, you're hearing various imaging studies out there, CT scan, X-ray. Well, MRI of the prostate is now being demonstrated to be very helpful to help us see what the prostate looks like and see whether something is suspicious about it. And we combine that with biopsies at this time to be able to know whether prostate cancer is really what's behind a PSA elevation. Now, once we make that determination, and we do a biopsy, because sometimes we'll biopsy and it comes back normal. Is that man had a PSA elevation? Hey, Mr. Jones, your PSA was 4.5, but we biopsied and it was just normal prostate tissue. It wasn't cancer. You just need to continue with your annual checkups. Hallelujah. All right, so we got to make the diagnosis. Once we make the diagnosis, how do you sift through all of this, reams of information out there and do the right thing if you're a Black man, or a man of any background, ethnicity, race group, what have you? And the answer is this: take your time to get informed. Have consultations with a urologist. Get a second opinion if you have to. There are some information booklets out there. I have even written a book, 2 books. One that's the Johns Hopkins Guide for Men with Prostate Cancer, which helps break down the facts. Get informed and be empowered to make good decisions. No doubt there are a whole range of different treatment options out there, from surgery to radiation to hormone treatments to ways of delivering various temperature treatments to the prostate. One freezing the prostate, other heating the prostate, doing all kinds of things to the prostate, cook it, bake it, fry it, everything going on. And how do you deal with all this stuff? The answer is go to a reliable urologist for a referral, get a second opinion, get informed. The decision that has to be made many times comes down to a number of factors. The factors include how, based on the biopsy, we can determine whether the prostate cancer situation in one man is a very aggressive form of prostate cancer or not so aggressive. Believe it or not, in some men, we find prostate cancer and tell them it looks like it's a mild type of prostate cancer, and we just want to monitor you with surveillance. So we got to define the prostate cancer. We got to define the health status of the patient. We got to know whether his health is good. What options make sense depending upon a person's health status. Can man even go through surgery? And what's his expected lifetime survival? Prostate cancer which in general moves slowly, unlike other kinds of cancers of the body, allows us to take a little time, even a few months, to sort out what's the right thing to do. That's what I'm talking about. Take a little time. And I'm not saying, take a little time and then come back 5 years from now. I'm talking about taking a little time over a few months. Other cancers like brain cancers, things like that, you got to make a decision within a couple of weeks or something, or faster sometimes. But prostate cancer, get it sorted out, review the various factors. And, for some of the decision making that's to go on, it may come down to patient preferences too. Patients may hear different options, hear what is the expectations of different kinds of treatments, what are the recovery aspects of different kinds of treatments, what are some of the potential risks of different kinds of treatments in dealing with the prostate cancer, and then getting all the different information. This all goes into what that person may decide after getting enough consultations and even a second opinion, may decide, surgery is the right thing for me. Or another person may say, no, radiation is the right thing for me. Another person, we might say, let's just hold off and monitor you. That's the right thing for you, sir. So there's all kinds of things that have to go into making the decision. And again, the point is that it's not a simple matter here. It's a matter of putting together all of these different aspects to make the right decision.
Super. So research. You're researching the prostate cancer. What's the future, and what do you see happening in the future? What are you researching at all, so that we all can have even more hope in understanding this cancer?
Well, in research, we're trying to understand what are the kinds of conditions that predispose to prostate cancer. Is it certain things about genetics? Is it certain things about our environment? Is it certain exposures we have, foods or diet or activities? Are we living in environments, for many Black men, in urban environments where there may be more pollution kind of things going on? Uh, if we can understand what are of the various factors that account for, particularly in the Black man's community here, African American community, why the rate is higher and why the death rate is higher. Okay, incidence rate and death rate is higher. We may be able to better identify what things we might be able to take action with to address. So really, that's what it's all about. It's all about saving men's lives, and the research has to do with trying to understand what are things that can help us understand how this happens, why it happens, and maybe take action. So, for example, genetics. There may be a story behind genetics, and we know that probably as much as 1 in 5 men with prostate cancer, genetics is a big, big factor. And so, if we understand what those things are, maybe we can help, first of all, make advances whereby men in certain families can understand that. But we may also be able to better take early action. And if it's not a genetic type, it's more sporadic. What's going on in the broader community that's not genetic? It's just different men randomly get it. What are these kinds of possible risk factors from research that will help us change how we go about uh, telling men how to live their lives, how to get their health checkups, and make sure that they don't die of prostate cancer.
So when you are working in your nonprofit status and reaching out to our community, how can we best support your movement? Because you've got a movement. I've always been proud when I get the emails to let us know that we're not alone. How can individuals engage and where should they go for more information regarding the movement that you have, Doc? Because we really appreciate what you're doing for us.
Yes, yes. Well, I'm glad you're saying that. Certainly as you mentioned, am involved with a number of organizations, health advocacy groups, various kinds of nonprofit organizations as well. Do things on professional levels too, with physicians who do such things as going down to Capitol Hill and trying to campaign for more the dollars to screen men, research money to help investigate prostate cancer, trying to get our legislators to put more money into the National Institute of Health and things of that sort. But for the individual man listening to this, please know that you can identify various support groups, advocacy groups that are out there. The American Urologic Association, there's Men's Two organizations, there's the Prostate Health Education Network, with tremendous advocacy groups out there, education networks. So these things are available. And I don't have the moment here to recite all of their taglines and whatnot, but I just want to at least communicate that these are your resources, and I think it's important to consider utilizing these resources. If you have prostate cancer, if you're worried about prostate cancer, if you think somebody else has prostate cancer or has been even through prostate cancer treatments, because yes, can be a life-changing situation, and having support groups is very helpful to men as well.
Cool. Well, ladies and gentlemen, you heard it first right here. I appreciate it, Doc. We appreciate all that you continue to give. If there's anything that you want to say to men today as it relates to their prostrate and understanding their history.
Well, my closing message, if you will, is just again, thank you for joining in. If you're hearing this interview and haven't turned us off yet, that means that you are recognizing that this is an important subject matter. And if anything, as I mentioned, it's common and this is serious. So please get informed. Please take action. Be there for yourself, for your loved ones. Get your PSA checked and get your health in order to be around a long time.
Hey, this is Muncie Steve with Health IQ with Dr. Burnett. Really appreciate everything that you did today, Doc, in educating us and letting us understand and have a deeper understanding about prostate urology and our role that we can play in better educating our community. I'm Muncie Steve here on Health IQ.